Dr. Todd Ellerin, the Chief of Infectious Diseases at South Shore Health. It's great to see you, Doctor, as always. Thanks for your time. Short time ago, and we just reported on it, the U.S. hit 400,000 deaths tied to COVID-19. Last spring, it was estimated there could be 100,000, then it jumped to 200,000, and now we're double that number. So what does that say to you as far as how the virus was handled or how Americans responded to the threat of the virus?
This is real sobering, Ed. Think about it. It took 4 months for the first 100,000 deaths. We will reach nearly 100,000 deaths this month alone. There have been more deaths so far from COVID-19 than World War I, the Korean War, and Vietnam. And we're approaching almost as many deaths as there were Americans who died in World War II. We've just had too many missteps, from testing in the beginning, mixed messaging, the lack of a national plan, lack of collaboration between the feds and the states. That's why we really have to make it up now with just a historically amazing vaccine rollout.
Can we talk about this new variant that is out there? There's an advisor to President-elect Biden that says that this variant is now in Massachusetts and other parts of the country, but that could lead to substantial increases in cases. Is that your sense too? And why would that be the case? Is it more contagious? I mean, that's what we keep reporting. Can it skirt some of the precautions?
Right. So we think these variants are more contagious, right? These mutations in the spike protein allow the virus to enter the cell. So just two quick scenarios. The first, the old variant, 1 million cases in the United States. If the new variant is 50% more contagious, now you have 1.5 million cases. When you have 1.5 million cases, you have 75,000 more hospitalizations and 5,000 more deaths with the extra number. So for an individual, the risk of hospitalization or death is the same. But when you look at a population numbers, then deaths and hospitalizations increase.
I want to go back to that skirting some of the precautions. I mean, we're wearing our masks. Is it getting past all of that?
Probably not. In all likelihood, the same infection prevention measures, mask wearing, distancing, avoiding crowds, washing hands, those will likely work against the new variants as well.
Well, and talking about those new variants of the virus right now, there is one researcher in South Africa that suggests that the variant found there might be a problem for the vaccines, that they may not be as effective. So what do you know about, what's the discussion around that?
So Ed, big picture first. Everyone needs to get vaccinated. Everyone who's eligible needs to be vaccinated. Now, how well will these vaccines do against the new variants? So far, preliminary research looks like we should do pretty well against the UK variant. Now, the South African variant has a little more, there are more mutations in that spike region. So the answer is still unknown whether the vaccine will work as well. But the good news is that messenger RNA platform, you can actually produce new types of vaccines within months. So that's good news, even if it doesn't work. But we're all trying to be optimistic. I think likely the vaccine will work. We'll see if it's as effective.
Dr. Ellerin, thanks for your time as always. Great to see you.
Guys.
Be well. Thanks, doctor.